Infirmary Report today, guys, we're discussing Mike Moustakas, the Kansas City Royals third baseman who suffered a knee injury. We're going to bring in the fantasy doctor, Dr. Selene Parekh, who's going to discuss that injury and give you his expectations for Moustakas' recovery. Doctor?
This is Dr. Selene Parekh, the fantasy doctor. Bad news coming out of Kansas City. Royals' Mike Moustakas is out for the season with an ACL tear. It's horrible news for the Royals, who on May 22nd also lost Gordon with his wrist fracture. So what is the ACL? Well, it's one of the major four ligaments of the knee, and helps to stabilize the knee when it moves from kind of a front to back motion. So with it torn, there's a lot of instability to the knee, which can lead to long-term issues and lack of performance. So it does need to be reconstructed. There are options on how you can reconstruct it, whether you use the athlete's own tissue, which is called patellar bone reconstruction, or you can use a cadaver or allograft tendon. The way you do it at this point is not really that important, but the bottom line is the surgical technical issues have to be taken care of, and that's easy. But the bigger issue is a lot of the recovery. And in the recovery, he will have a lot of therapy, working on muscle reaction time, working on motion, working on swelling. The rehabilitation is what really takes a lot of the time. And you're looking at 9 to 11 months before he's back on the playing field. So hopefully he'll be ready for spring training, but there's no guarantee on that. It is highly doubtful that he will be available at the end of this year, even if the Royals make it deep into the playoffs. So for all intents and purposes, he's done for the season. We'll see him back in spring training, and hopefully he'll have a good 2017. This is Dr. Selene Parekh, the Fantasy Doctor.
We'd like to thank each and every one of you for subscribing to the channel. If you enjoy the content that we're making at the Infirmary Report, please slap a like on the video, and we'll see you next time.